So, this is a common question and something that causes great concern for women. So, let's get into it. So, thinking about risk of breast cancer, I think we really need to start by looking at what is the risk of breast cancer in the population as a whole. And in general, if you were to live to the age of 80 as a woman, your risk of breast cancer is about 1 in 8, or something near 13%. However, there are populations within our general population that have a higher risk than that. And this is where we can identify that risk and put in measures to help either identify cancer early or reduce that risk. So, what are those elevated levels of risk? Well, someone who has a moderate risk of breast cancer, higher than the normal population, we define as anywhere between 17 and 30%, so nearly 1 in 3 chance of developing breast cancer. Whereas the high risk is greater than a 1 in 3 chance. And there's also a very high risk group where it can be up to 4 out of 5 chance of developing breast cancer. So how will you know whether you need to be assessed and whether you have a higher risk? Well, it all starts with your family tree. And what you need to do is look at family members, if they've had breast cancer, how close they are to you. So we talk about a first degree relative, which is a mum, a sister, or a daughter, or then a second degree relative, which is a grandmother. And then we talk about the age at which those individuals were diagnosed with breast cancer. And there's quite a complex algorithm that we can use, putting all that information about your family tree to tell us what your risk may be. Now, what I would say for you is that all you need to know is that if you do have family members with breast cancer, certainly any who are under 40, or more than one who was under 50, or more than 3 who was under 60 at the age of getting that diagnosis, then you may have a higher risk. In addition, please be aware that if you have an ovarian cancer risk, then that may also elevate your risk. So, what should you do? Well, if you do have that higher risk, suggestive of your family tree, then please do reach out to your GP or a breast clinic. What we can do here is assess that risk and determine whether we need to formally test you or not for specific gene defects. This will allow us to tailor a plan that helps you manage your risk. Wishing you all the best.